Cool. Well, hello everyone, and welcome to another Just Love podcast. I'm Elizabeth. I'm the president of Just Love Oxford. And if you've not come across us before, we are a student organization that exists to inspire and release every Christian student to pursue the biblical call to social justice. And in this time of lockdown, that's looked a lot more like learning and praying into specific justice issues, which have been sort of brought to the attention maybe by the past year. And today we are going to be thinking about mental health, and we have the wonderful Esthy with us to chat about that. Esthy, would you like to introduce yourself a little bit, tell the people who you are?
Yeah, I'm I study physics at Oxford. I'm in my fourth year at St. Cat's, and I've been quite involved in like the sort of homelessness stuff that Just of Oxford do in the past. So been roped back in for for more.
Yeah, and when you say you've been involved, you were fully on committee for a year. Yeah, and you did great work. And yeah, I'm so excited to have you to um, yeah, have this conversation about a really important justice issue today. Do you want to talk a bit about what mental illness is, what mental health is, your heart for that sort of, yeah, chat chat through that a little bit for us?
Yeah, I think it's important to define what mental health is first. I looked this up before, but on the World Health Organization, they define mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community, which is a pretty nice definition.
Mm-hmm.
So clearly, like mental illness is like a disruption of that. Mental illnesses are conditions which involve like changes in thought, emotion, and or behavior. Yeah, the ones we most commonly know about are like depression and anxiety. Yeah, however, I'm very keen on making sure people know that there's like plenty of other ones out there. Yeah, like for example, personality disorders are like quite a taboo topic, but they're very common. They affect 1 in 20 people,
Mm-hmm.
um, and and bipolar disorder is I think 1 in 50 people have that as well. Things like psychotic disorders as well. Like I think it's really important that we're not scared of kind of those words, and yeah, and also just also like various type of like things like eating disorders too. So,
Yeah,
yeah.
yeah. Do you have any reflections on sort of how I feel like over this past year, mental illness and mental health has been much more in the cultural dialogue? Do you have any reflections on how that's changed over lockdown?
Um, I guess so. I think I'd say that often mental illness likes to thrive in isolation. A lot of people have been doing that over the last year.
Yeah.
So increasingly, we've seen like so many more people struggling with their mental health, and hence an increase in the conversation about it. Yeah, which makes it good and bad. Yeah, but I think there's been so many reports of things like children's mental health have worsened quite a lot over the last year, and adults as well.
Hmm.
Yeah,
Yeah. So you said that makes it good and bad. Do you want to explain
I
that a
guess
little bit?
good in terms of in terms of the actually, I'll start with the bad first. So bad, um, of course, in terms of you kind of don't. It's not nice that more people are struggling with their mental health, basically, um, and and also that means increased pressure on mental health services around the world. They've been more stretched, less able to look after people. Yeah, I have a friend who works in children's mental health services like who saw her workload like double or triple just over the pandemic. Definitely bad in that sense. I think the good thing that has come out of it obviously is that it's becoming an increasing issue. I think more people are like um us are writing about it, and I guess speaking up about it, um I and I think it's something that the government has become aware is an issue in the health services, and something that needs to be addressed. Whether they actually will address that or not is another question.
Yeah, yeah. And so I think it'd be good to sort of then think about why we as Just Love are thinking about mental illnesses, because it's not sort of, you don't think of it necessarily as like a justice issue like the way we think about, you know, homelessness or human trafficking, or maybe sort of the more like typical social justice causes. So why do you, I know you have thought about this a lot and you're really passionate about thinking
Yeah.
about mental health as a justice issue. So do you want to tell us a little bit about your thoughts there?
Yeah, no, I like agree with what you just said there. There's been like, I think for a long time it's I've often not been able to like pinpoint what exactly like about it is related to, or yeah, links with justice. It's kind of quite different and complicated from the way just like homelessness, for example, is. But then I've always felt like this kind of feeling in my, just like in my stomach and in my heart, just like that, like this is something that like really breaks my heart, and like I know that this is a justice issue. Yeah, so I think one thing to one important point to point out is that like mental illness is often a product of injustice.
Mhm.
Um, the prevalence of poor mental health is the highest in the poorest communities.
Mhm.
Um, and there's, for example, like in the sort of homelessness work I've done, there's a lot of people I've come across who struggle with their mental health. And also a lot of them have been through some like really difficult trauma traumatic things. And there's a huge link between like childhood trauma and uh, which looks very differently for many people. But that's something that ends up impacting a lot of people into adulthood. Um, and for example, there's a lot of studies which show that um, out of those who are diagnosed with bulimia, there's a high proportion of those who have suffered from sexual trauma or abuse, which is quite heartbreaking. So yeah, and yeah, furthermore, just like linking onto the kind of just yeah on what you just said about like mentioning eating disorder. There was like a recent UK National Health Survey that said that reported that prevalence of eating disorders was highest in the lowest income population in the UK, um, which kind of um, which kind of flips out this like stereotype that often is about things like eating disorders being this like white middle class teenage girl problem. Yeah, they found that the prevalence of eating disorders decreased with as income increased. Yeah, so I definitely think that part of um, part of our call as Christians to be looking after the widow, the orphan, and the hungry, as we're told to so often throughout the Bible, is not just addressing physical needs. It's not just giving food and shelter.
Mhm.
It's addressing the addressing individuals as a whole, addressing their physical, mental, and spiritual health.
Yeah.
So so it's a it's a thing that like is really important to think about when we're um, thinking about pursuing justice. Um, yeah, and I guess yeah, another part, I guess, stigma. Like I think stigma in general, whatever it is something that ostracizes people, and yeah, it casts people out of society, and yeah, particularly in when it comes to like just the realm of like mental health, certainly various various like aspects of mental illness like personality disorders, psychotic disorders, are things um, that tend to be quite highly stigmatized, and it can be really prevent people from getting help that they really need. Yeah, and like I think the aspect of this that's probably biggest on my heart at the minute is there's a huge problem in access to mental health care all around the world, but I know more about the UK because I live there. um, yeah. So like many services just like do not have the resources to see everyone, so they only see those who are most unwell. And it's something that really breaks my heart. Like one of my friends last year attempted to take her own life multiple times in a very short space of time. Very came close every single time, came very close, um, and had some crisis support, but like after that, nothing. Which which really angered and frustrated me.
Yeah.
Yeah, and yes, and like, and there just seems to be this kind of the way mental health services currently run at the minute is that they can only see people when they're like literally at death's door and get them out of crisis and then discharge them. And it really strikes me how different this approach is from everyone's approach to physical health care. So my brother Sam, he has epilepsy. So often when he has a seizure, he dislocates his arm. Um, and the the first time we didn't know what happened. He got sent to A&E, but also after that he was followed up with having physio regularly to try and build strength back up in his arm to prevent it dislocating again, um, and to stop it getting worse. And similarly, like a friend who fractured her wrist and that got patched up, and then she was followed up with physio very soon after to to keep it, yeah, to help heal it and to make sure that wouldn't happen again. And there's just like not that sort of approach in mental health care at all. Yeah, which and like mental illnesses are like more dangerous than like a fracture is. And like for example, in cancer care, like the first time you go to the GP, they detect a symptom and that gets addressed straight away. You get referred and scanned and everything. Um, yeah. However, like often with mental illness, you get referred to GP, and the GP is like, yeah, like there's there's nothing we can do. Or the GP might be dismissive of your symptoms. Yeah. So there's just like a yeah, really, and like I just have so many, like I know a lot of people who struggle with mental illness, and something that always comes up like just time and time again is people struggling to get help um, until they become really unwell, um, which which really yeah, and I really just don't think it should be that way at all.
Mhm.
Yeah.
Yeah, thank you. There's a few really good points you made there. Like the first, you were talking about um, sort of the like almost intersections of different justice issues and like seeing mental illness as a result of a lot of other injustices. I think that's a really helpful way to think about the whole, even we're talking about like the wholeness of like a human, you know, and that involves their mental health. Like when we think about the wholeness of society, like that has to include sort of the implications of other injustices we're more used to seeing, you know? Yeah, and then you were talking about stigma and sort of like how that ostracizes people, which is, you know, so often what we see Jesus working against. He like brings in everyone who
Exactly.
like no one would you know, want to accept. I was thinking about you know, the story with the lepers when Jesus heals the leper. Obviously, you know, that's like very much a physical illness, and we're thinking about mental illnesses. But I think it sort of gets at the same point, you know, because like people who were lepers in the ancient world like were completely put out of the community, and that's who Jesus goes to, you know. So yeah, I like, yeah, we see Jesus going to people who are left out and ostracized, um, because of like lots of stigmas. And so yeah, that's just, I think, a really good way of helping us understand like how we should, you know, care for those who don't have good mental health at the moment. And then last point, you were talking about access, which I feel like that's like almost the most obvious sort of justicey thing about it, you know, because we want people to like have access to good healthcare. Um, so yeah, and it's just from what you're describing, it just seems like a really, really sad state. Um, yeah, and it's just it's so heartbreaking that the system works that way. I'm wondering, do you think you sort of like were talking about like, oh, going to the GP and like being dismissive of symptoms and stuff like that? Do you think I guess why do you, maybe you don't have a good answer, but like why do you think that is? Like why do you think society in general doesn't seem to like give as much attention to like mental illness versus something that's physical?
Yeah. Like I think most obviously because it's invisible, like you're not walking with a physical crutch or anything.
Yeah.
Yeah, and it's um like I think for example in the medical curriculum for medical students, I think there's a lot of I've heard views from professionals that they don't think that there's enough coverage of certain aspects of mental health in the medical curriculum. So like education is like definitely very important in that.
Yeah.
Um, yeah, and um, I guess there's many aspects to it. Yeah. Um, my mind's going blank. Sorry. Yeah. Um, I guess yeah, and I guess because it's also just like such a spectrum as well.
Mhm.
I think all of us feel low and like and and anxious at various points. Like all of like all of us have like days where like we don't want to eat or we want to eat everything. Um, and like yeah, and all of us will have our mood swings and everything at some point. And um, so I guess perhaps sometimes it's a bit harder to define like um, to for example for someone in like primary services like a GP to see more clearly where that crosses over into something that's actually kind of quite serious.
Yeah.
Yeah,
Yeah. Yeah. Um, I think we should talk now a bit about sort of mental health and the church.
yeah,
Um, you know, I'm a Christian, you're a Christian, we both go to church.
oh yeah,
And we've been talking about, you know, sort of how Jesus would handle these kind of issues. And I'm just wondering, what has been your experience, I guess, in sort of looking at, or you know, even just being someone who is really passionate about justice for people with mental illnesses and sort of doing that in like the Christian world.
yeah. I guess I'll like I can yeah I can say that like so for example in the past I've spent quite a bit of time in a psychiatric hospital as a patient myself, and in that I met so many people, so like some of them are like have been just like some of the most beautiful people I've ever met, and it just really broke my heart because a lot of them told me that that um, their family and friends had kind of left them behind um, as they'd been ill, and kind of moved on with their lives while they were still struggling and stuck in hospital and stuff. And that like just really got to me because these are exactly the people that Jesus would be seeking. You know, those who have been like left behind. And like I felt like I was just like the world should know these people because they're just like so great and like they're like fantastic and beautiful and the world should know them, but they don't because they've left them behind. And I think that's yeah, that's like really such a shame. And I know that um, Jesus would like seek them out. Um, so I think that's I think which I guess brings me onto like um onto so I have a like a broad, it might be a bit bold of me, but I have like a bit of like a vision for a kind of culture change at church in yeah and in the Christian world, that um yeah that all of us would go and seek out those who've been left behind by society. not just those who are mentally ill, but people across like who've been left behind for all sorts of reasons. Yeah, and I think um, I'd love to see a church in which someone who struggles a lot with their mental health, perhaps they have personality disorder and maybe may be seen as and struggle with things in a kind of quite with struggle with a lot of things kind of thing. But I love to see an atmosphere at church where this person is loved, respected, and seen and welcomed, like as much as the senior pastor of the church is. Because and like I also would love to see church being a place which feels which gives a sense of realness. I think it is easier to in general to share when we've gone through something and overcome it and be like, I went through this thing and I've overcome it, yay. And I think even more so in church, this can often come out as like really fantastic testimonies of the way God has brought and led us through something. But often for a lot of people who are in church in a service, like who might not necessarily have come out to the other side yet, and something I think is can be really powerful is someone being able to say like, here I am, like things are really hard right now, but I know, and I can't feel it in my heart, but I know that the Bible says God is Lord, God is sovereign. So I think in a very like broad way, I think that is, I'd love to see that more and I would love to see that increased just in church. And then on a more like practical level, I guess like in the Christian community there tends to be more stigma in mental illness related to like weakness in faith or like spiritual possession. I met a friend in hospital who told me that her family, who were all members of a church in London, she once walked into a room to see like family and family friends like ready to crowd around her and pray for her to be for like an evil spirit to be cast out of her. When what she needed was therapy and treatment for her addiction difficulties and her eating disorder, and her and other aspects of her mental health. I think it's in the UK, this is probably slightly less of a kind of of an of an issue, but it still is one. And so so I guess in order to be able to like tackle the stigma, like education is really important. I know that in my church back home, up in the northeast in Durham,
Put that in there.
there's they've in the past had some mental health workshops which focused on some aspects that Christians might not tend to perhaps be a bit more afraid to speak about, like I guess like issues like what is self-harm, like kind of thing, things like that, eating disorders, other things. So education is key. So it'd be really great if like all churches could be equipped and educated on what mental illness is and how to deal with it and how to encourage people who are struggling and suffering within their church to be accessing treatment, to be taking the medication. And something that I listened to recently. So there's this guy called Will Vanderhart who is the leader of Mind and Soul Foundation, which is like a Christian mental health charity. He pointed out that they don't, like, Christians struggling with their mental health don't need um, a, a Christian counselor. They need like a good counselor, and and so like, yeah, really like kind of interesting kind of thought, and it points to the fact that, like, to not be afraid to well, yeah, just to encourage people to be going and seeking like medical treatment, like they like someone would for diabetes, or yeah, or like a sprained wrist, basically. um yeah. um does that answer the question?
Yeah. Oh my gosh, Esty, what an like that's such just an inspiring vision of a community and a family and of like what the church should look like if we're all, doing what Jesus tells us to do. I think it's yeah, I think we should dream big and have those visions for, our like local churches, but also for the church more widely that
Mm.
Christians can be known as the people who like accept the lost and the people who are struggling. Um, yeah, I think it can be really difficult then. I know I've come across it too where it's like, oh, well, if you pray enough, you won't be, depressed or sad or anxious anymore. And um yeah, or if you have, personality issues and like you must be possessed because, you know, it can get really really twisted and really complicated. Um yeah, when you were sort of talking about that, sorry, motorbike just went by, but when you were sort of touching on that, I was thinking about, how we see Jesus a lot in, the Gospels, sort of casting out demons, or there's disciples casting out demons. And, I don't want to say that demons aren't around, of course. But I think also, if Jesus were here today and like he told his disciples to go out and heal the sick, I think, that could look a lot different. It would look like, making sure people have access to good healthcare and
Yeah.
including like, healthcare for mental illness as well. So I think we should, yeah, think more about what our vision almost like of health is, of spiritual and physical and mental health, and how, yeah, Christians are called to pursue that as well. Yeah. Yeah. But I think it really starts with this. Yeah. You spoke about it so well, the vision of family and community in the church. It's like, it's so encouraging. I'm like, yeah, let's do it. Let's go be those people in the world. So good.
It'll be real with people.
Ah, yeah, it's really great. Um, awesome. Yeah, thank you so much for all those answers. Um, and you are someone who is going out and doing this kind of work in the world right now. Do you want to tell us a bit about your involvement with the End Eating Disorders Now campaign?
Yeah, sure. Um, so particularly in um, yeah, I guess so. Uh, right, stuck words. Yeah, so I'm involved in a campaign, as Elizabeth has said, and basically, like, it started basically when a friend came to me crying because she got a letter being told that she couldn't be seen because she wasn't severely unwell with her eating disorder,
Mhm.
which really like which which just really like, I just like felt something in my stomach. Then I just like felt like almost physically sick because I was like, because um I knew that, I think, if that had been the case for me in the past, like, I really may not still be here today. And it just really sucked that, like, so many people are having to go through that. And then I also found out that like, waiting times for eating disorder treatment in Oxfordshire has is now 100 weeks. So the waiting time used to be 9 weeks nationally, like across, but in Oxfordshire it was already something that was quite pressing, and that was already quite long. But over the pandemic, that's just gotten worse, and it's been very similar across the entire country. So I got in touch with like, yeah, one or two people, and we were like, should we like write a letter to our MPs, get as many people to sign it as possible, and basically started from there. And so we've got two campaigns running. We've got our national one, which is addressed to MPs and asking them to bring it to government, and and to highlight the urgency of this situation. That there's so for example, you can see the in the letters, you'll be able to read the whole thing. It's quite long, but so one of the aims we're asking for is more funding, of course, and putting policies in place which ensure that people can receive treatment earlier. So waiting times, and things like increasing research into treatment, because often treatment isn't successful at the minute with eating disorders, and there's like not enough research around why that is, basically. And also to be increasing medical training as well, so that medical professionals can spot this earlier. And because like with physical illness, you want to tackle something earlier to like improve the prognosis of it. And you definitely want to do that with eating disorders as well. And our university campaign is so we also have a letter written to the Oxford University Vice Chancellor, demanding for increased provision at university for students to be able to, suffering with an eating disorder, to be able to access support, especially because there's a fitness to study guide. There are fitness to study guidelines. However, the point at which a student would be deemed eligible to receive NHS treatment is the point at which they also fail the fitness to study guidelines. So, like, in order to be able to access treatment in Oxford, they have to be too unwell to be at Oxford, and we really don't want that. So we're calling on the university to increase provisions there, and you can also see what exactly we're asking for in the letter.
Great, yeah, and we'll link all the things in this video. So yeah, that's really, really exciting, and it's always so encouraging to like hear, see students going out and doing things in the world that have the potential to make a real difference. So yeah, it's I'm so excited about it, and I think it's so awesome that you're a part of it. Yeah, and so as Just Love, we want to be, doing whatever we can to support the campaign. So, encourage all of you guys to sign the letters and read through all the stuff. You've got a brilliantly, beautifully designed website. I've had a look through it. I love it.
Yeah. And www.endcrisis.com. Check it out.
Good plug. And Instagram as well, also beautiful. Yeah, it's such important and encouraging work being done. And so yeah, we want to we've wanted to just use this conversation as a chance to help Christians think a bit more about mental illness and mental health. And we're gonna carry this on next week. So Tuesday of fourth week, we're going to be doing another prayer night, and Esthy will be with us to help us pray into these issues in a way that can be effective and helpful and good. I think we're thinking a lot about prayer this term, and so we want to be equipped to pray for justice issues well. And so we're going to be doing that next Tuesday, fourth week, and then throughout all of fifth week, we're going to be running a fundraiser for Beat, which is an eating disorder charity, and so keep an eye out for that in fifth week. Esthy, do you have anything else to say? Any other last nuggets of wisdom?
Like, yeah, I don't think so. Well, I guess reflect on my point of being real. It's very hard to do because it requires being vulnerable, but also extremely powerful. Something something actually. Me and Elizabeth go to the same church, so at our student night on Thursday, we had this like message really reinforced that of power in weakness, which Paul says a lot, a few times in the New Testament, and it's And I think, yeah, I think the culture change is possible. If like for us to all be able to be real and fun. It's really, really hard, but also really powerful. And just one person be able to do that is would be incredible.
Yeah.
So yeah.
Oh, amen. I think that's a great place to end. Esthy, thank you so much. I've learned a lot. I hope everyone watching this will have learned a lot. And yeah, we'll see you on Tuesday for some prayer.